Let's now welcome Alef Meulenberg, the CEO at RHIZA Holdings, as we look at the importance of running wellness initiatives that actually educate young people on STIs and the safe use of condoms. Alef, great to have you with us. Welcome. Happy Valentine's Day. As we talk love and romance, we also need to pair it with this responsible behavior in intimate relationships as well as individuals in order to safeguard ourselves against the multitudes of STIs as well as other illnesses.
Thank you so much for having me on the show, and happy Valentine's Day to you as well, and 100% agreed with that statement.
Thank you, Alef. Go ahead.
I think the topic at hand around sexual reproductive health issues is very important, particularly around Valentine's Day and people wanting to have fun, but doing so responsibly and educating people to do so responsibly is a really, really important topic. It was very pleasant to see very, very many familiar faces, because the lady who was interviewed before in the statement, Gugu, runs one of our clinics in Umlazi, and we partner with Goal Effect as well on sexual reproductive health rights issues. Very important topic that you're addressing here today, and very potent to address it on Valentine's Day.
Absolutely. I mean, Alef, what sort of campaigns are you currently involved with, or running pertaining to the promotion as well as the proper use of condoms? I mean, we know that it's still a safe condom week here in South Africa.
So what we are running are campaigns particularly focused on high school students and young people. And it's not just on only the use of condoms, it's on sexual reproductive health rights. And it's also on things like family planning and like wanted pregnancies. In South Africa, most of the children that are born, 64% of the children that are born are not planned. So there is a lot of improvement we can achieve if more pregnancies are planned, and you can only do that by educating the consequences on the one hand of not having planned pregnancies, or the consequences that can come through STIs and through HIV and AIDS, but also the consequences of planned pregnancy. So that it helps a lot when it comes to the mental well-being of the parents, but also of the child. If the child knows that he is desired or she is desired, and that there's a family unit to support the child. So it's on the one hand sexual reproductive health, and if one becomes pregnant and doesn't want to have the baby, to have safe ways of terminating a pregnancy. On the other hand, it's also educating around HIV/AIDS, which has lost some of its danger, so to say, because it's now treatable in a way with ARVs. But it's at the same time, it's a lifelong disease. It's a chronic disease, and we want to ensure that people are well equipped in order to not become HIV positive or attract STIs by having protected sex.
So it's quite a range of initiatives that you're actually involved with, Alef. I mean, and I suppose it's quite important to also note that putting on a condom is the first step to safety, but the correct usage of it is also very important. So what type of concerns or questions or even inquiries do you normally get about these very important matters?
The first inquiry we normally get is what kind of protection is available, and ironically that mostly comes from females. So what kind of protection does a female have when it comes to wearing a female condom, or when it comes to not wanting to become pregnant? Then how can they have conversations with their partners in order to have safe sex? So, and those are conversations that are often taboo in households, and therefore they come to us, to our clinics. We currently operate approximately 20 clinics, of which 10 are based on a nursepreneur model like the one in Umlazi. And we have mobile clinics that go from community to community. And then patients come to these clinics asking those kind of questions. And they're met by a friendly face who is a registered nurse or a social worker to help them with those questions that are normally difficult to ask.
We welcome that, Alef, because, I mean, speaking on that subject being very taboo, we know that some families still do not even venture into sexual talks or even education between parents and their kids as well. So what are you observing also then in terms of stigma, as well as the reluctance of those that do not come forward for clarity? Do you think we're slowly getting rid of these barriers where some feel they cannot come forward? And also, Alef, I mean, we live in a fragmented society. child-headed households where these children, as they grow, do not even have adult assistance or supervision on what some may think are easy or need-to-knows pertaining to these wide-ranging issues when you become an adult?
I think in today's day and age, it's almost impossible not to know anything about the topic, right? Due to internet and due to exposure on internet and in schools and in classrooms. So what we normally tell parents is if you do not educate your children, someone else is going to educate them.
Yes. And
what they teach them might not be in line with your family values or might not be in line with how sex should be perceived in general. So the advice we normally give is really talk about it. Talk about how you see it. Talk about what values you have around it. Talk about the importance of having protected sex if you're engaging in sexual activities, and have those conversations at appropriate ages. So not when the child is too young, but also don't wait with it too long, because then they will be informed by someone else.
When is the appropriate age, Alef, to start introducing your young ones to the idea of sexual behavior?
So what we see is that some of the patients that come into our clinics can be pregnant at as young as 13, 14.
Nice.
So when hormones start running, you need to have the conversation. So we normally say when someone is a teenager, you should start having the conversations. And before that, you can slowly start bringing into the conversation that, okay, this is how babies are made, or these kind of things, so that people understand. The children understand, but that's a more elaborate discussion around being sexually active and protection and sexual reproductive health and rights and stuff like that. For us, it's more when someone is a teenager.